And what kind of advice would you give someone that is going into an organization like that, as in their first big girl or big boy job? What kind of advice would you give them looking back on it now?
I would say go in with your ideas and voice them. When I first got there, like I said, I had so many ideas, and at first I was scared to say anything. In the meetings, I would be quiet. I really wouldn't say a lot. But as time went on, I began to voice my ideas to my supervisor and her supervisor, and they were receptive to it, and things just really opened up and flourished from there. So I would say always voice your opinion.
That's important, and it can be hard to transition from maybe like being a student or being an intern to then working in a
Hmm.
full-time job and like being in meetings and then feeling like just intimidated or like feeling like you don't have anything to say or like what you are going to say doesn't make sense or like just
Yes.
a lot of those things. But I'm glad that you share because I think like to the point of all of us have our lived experiences mixed with the educational experiences that we have, so you do bring a unique perspective to every table. So I think it's important that we all continue to use our voices and share the things that are important to us because you never know where an idea will take us.
Hmm.
And then you transitioned into the district liaison for COVID-19 Spark operations. Tell me about that transition.
So during the beginning of COVID-19, we were reassigned. Everyone within my office was reassigned to the health department to assist with the rising COVID-19 outbreak in Georgia. I served as a district liaison while still having to be the community health coordinator and project manager at the time. So I was basically doing three roles in one. It was really difficult, but I managed and maintained the specimen point of collection, clinical drive up operations. Basically, I ensured that appropriate PPE was used at all times. I scheduled specimen pickup with clinical laboratories and vendors. I completed daily operation reports, which included things like the number of specimens collected, average time spent with each patient, specimen kits received. I also conducted inventory tests to ensure that we were receiving an accurate amount of COVID-19 related materials like test kits and gloves. And I also had the opportunity to train temporary staff on how to use the database that we were using for patient information. And I also had to serve as the health safety officer. So I had to monitor body temperature fluctuations and the onset of COVID-19 symptoms among the health department staff. So it was a really good experience. I also, during that time, received an award for my work during the COVID-19 pandemic. It was called the COVID Quarantine Hero, and it was for exemplifying leadership, motivation, dedication, and tact during my reassignment to the state COVID-19 response team.
Well, kudos to you once again. And I guess a bigger question is it seems like that would be a lot.
Yes.
Not only having to deal with like shifting and doing three roles, but now living in a world where COVID is impacting like our daily lives and just how we operate. What was going on when that happened for you?
It was so much going on at that time. Basically, when it first began, the health department was flooded with like so many tasks that needed to be done. It was ridiculous. We also had to work on the call line for COVID-19. So while some days we would have to go into the health department, some days we were allowed to work remotely so we could answer the call line. And I remember sometimes I would have like over 100 calls a day regarding COVID-19, and it was really overwhelming. But I would say that it really gave me a different perspective in terms of public health and allowed me to develop different skills.
Yeah, well, thank you for that work.
Thank you.
No, don't thank me. I wasn't doing nothing.